What is Bio Longevity Dentistry? Bio Longevity Dentistry combines what has actually always belonged together. Longevity medicine on one side and biological dentistry or dentistry on the other. By combining modern scientific findings from practice and research, it attempts to bring the essential new insights under one roof, streamline the maximum benefit for the patient, and convert them into practical concepts. Modern biological dentistry is, in a way, the blind spot in longevity medicine when viewed in general. What does longevity medicine normally look at? It concerns itself a great deal with nutrition, supplements, gadgets, peptides, the latest signal peptide, and so on. It concerns itself with sleep and recovery, sleep phases, tracking blood sugar trends, and HRV optimization. It attempts through training concepts not only to measure VO2 max as a central metric for longevity, but also to optimize it through corresponding training plans. It concerns itself with building strength to prevent sarcopenia, and so on and so forth. But in this modern, thoroughly sensible, and scientifically sound good longevity medicine, much of what happens in the oral cavity is overlooked, even though it is, in principle, the gateway to the organism, or one of the most important gateways and control organs for the entire organism. Let's take the oral microbiome, for example. That is mostly ignored, even though it massively influences the systemic inflammatory load, usually negatively. Toxic materials from the oral cavity, as they are often widespread in conventional old-fashioned dentistry. A typical example is amalgam, metals, or any other old-fashioned restoration concepts that have become outdated, corroding materials, unhealthy plastic particles, etc., which negatively burden the immune system and the entire metabolic state, usually in a creeping manner. And of course, what is often overlooked in traditional longevity medicine, in my view, actually one of the most important subject areas, is the subject area of chronic silent infections, usually combined with chronic inflammation. And as the name suggests, with inflammaging, the aging effects that emanate systemically from these chronic infections and inflammations. A typical example here is periodontitis or gingivitis, as one of the most common oral diseases of all. About half of all adults are affected to a greater or lesser extent, but also unnoticed jaw osteotitis, i.e. chronic inflammatory foci in the jawbone, for example, around dead teeth or residual osteotitis after tooth extraction, etc., and simply immunoregulatory problem areas, interference fields, as we have known them well in holistic dentistry for decades. All of this significantly influences cellular regeneration, usually unnoticed, and is an important cofactor for the development of most major chronic systemic diseases such as diabetes, endothelial dysfunction, insulin resistance, obesity, cardiovascular diseases, cancer, and many others. In Bio Longevity Dentistry, we try to optimize all these aspects. In a way, we are not just optimizing lifestyle in the classic sense of longevity medicine, as is quite common and also very, very well scientifically founded. But above all, we do not ignore the gateway, the most important gateway and control center to our body, namely the oral cavity. And true longevity is not possible or simply insufficient without biological dentistry. What is biolongevity dentistry? Summarized differently, it is the convergence of biological dentistry and longevity medicine. The mouth is no longer viewed as an isolated system, but as the primary control center for extending the health span, because that is actually what longevity medicine is significantly about. We all want to stay fit and healthy for as long as possible with maximum mental vitality and fitness. To briefly contrast it again, traditional dentistry, or rather old-fashioned dentistry, aims at symptom treatment and the mechanical repair of dental damage such as cavities, tooth decay, holes in teeth, broken teeth, but also periodontitis, loose teeth, and tooth replacement isolated from the rest of the body. It is certainly an honorable discipline, it is also important, and it can do good things, but it naturally never views the entire organism as a whole, but rather the tooth as a dental tool that needs to be replaced or repaired, or at best, maintained. Biological holistic dentistry views this much more holistically, with a major focus on the biocompatibility of materials, the removal of toxins such as amalgam, and many other things. And it focuses on the detection of interference fields, i.e. the diagnosis and remediation of interference fields and foci, and thus naturally optimizes the system as a whole quite significantly. Bio Longevity Dentistry, as we define it here, goes a whole step further because it naturally considers the broader overall context under the critical aspect of promoting healthy tooth development. We place optimal prevention as the absolute highest priority, and we are deeply committed to the promotion of healthy jaw structure, proper tooth alignment, and optimal airway development as a whole, starting right from early childhood and continuing throughout your life. And biolongevity dentistry naturally takes care of the proactive optimization of biomarkers of all kinds, the oral microbiome, inflammation markers, sleep, and the airway, a crucial factor for longevity, because only with this is the maximum extension of a healthy and vital life ultimately possible. Naturally, in the second instance, biolongevity dentistry, in addition to prevention and the promotion of optimal healthy development, also takes care of the optimal restoration of dental damage that has already occurred. This is about which restoration concepts, which materials, and which dental implantology concepts are optimal here, and which other lifestyle optimizing measures are most ideally suited not only for maintaining dental health, but of course also as an overall concept for health span, for extending the health span. And interestingly, on a scientific basis, these are the same measures that also serve for optimal dental health.